Hey Ryan, what are you thinking?
I had heard of HIV, of course, but I wasn't taking it too seriously. And man, it is serious stuff.
No kidding, man. This stuff is tough and it's around us. We need to deal with it.
True story. You know what will help?
What?
Knowing how HIV can be treated, and better still, how it can be prevented.
Tell me!
Alright, let me tell you about treating HIV. Or wait, here's a gift that says it all.
There's no cure?
You got that right. Science people are trying to get a breakthrough. But, like I said, HIV is tricky, and today there's no cure.
In that case, I want to know about how not to get HIV.
Yeah, how do we reduce the risks?
The safest way to not put yourself at risk to contract HIV is to practice abstinence and not participate in sexual behaviors or use drugs with a needle.
Hey, I have needs, man. Abstinence?
Okay, if you don't choose abstinence, Nurse Kyla said the next best thing to use is a new polyurethane or latex condom every single time you have sex. Also, being monogamous in a sexual relationship with one person only will decrease your risk of getting HIV by a lot. Just make sure you and your special person get tested for HIV and STIs first to make sure you are both safe. If you plan to be sexually active, get yourself tested every 6 months. If you start seeing someone else, get retested before you have sex. Basically, practice abstinence or a monogamous relationship. If you can't, get yourself tested every 6 months or when you change partners.
That makes sense, and is doable. Hey, wait, what do you mean by using drugs with needles? I mean, I know those drugs are off limits, but what about drugs that are medicine? Some kids I know need to inject insulin for their diabetes, man. How can they not use needles?
Chill, man. It's simple. If you are a needle drug user, just don't share needles with other drug users.
Yeah, but now that you mention it, doing any kind of recreational drug or drinking alcohol can make you more vulnerable to making poor decisions and put you at a high risk. If you're going to participate with high-risk behaviors where you may contract HIV, speak to your healthcare provider about whether or not the PrEP pill is right for you, and make sure you get tested regularly to not put any partners at risk. Better still, don't do it.